Peace be to you all. AsSalama'laikum. This is Omar Abdul Malik, physician associate. It's hard for me to get used to saying that after 20 years of being a PA. I'm also a health educator, and for those of you guys that follow me, I'm also a moderately fit, middle-aged distance runner. So today I want to do this evening, I just got off from work, so I want to do a very quick book review. Some people asked me what I thought they should read before starting medical school or PA school. So I could recommend this. This is called Clinical Chemistry, and you will have to take this course. I don't know about medical school, but you will certainly have to take this for PA school. And you should know this for medical school because you're definitely going to have to know this information on your rounds, especially things like internal medicine and emergency medicine. So this book is by Jeremy Hughes and Ashley Jefferson. It's Clinical Chemistry Made Easy. It's a very small book. You see it in reference to my hand. It's about the size of my hand. It consists of about 180 pages of actual written material. And it gives you a very good, what I think is a very good overview of the various things that you need to know for your clinical chemistries. This was a very challenging course for me when I had it in PA school and when I had it in nursing school. It killed me. So really quickly, my advice to you, somebody was asking me if there was information I thought that they should come into PA or medical school with. I would say memorize your reference ranges for things like your BNP, or your CMP rather, so your complete metabolic panel, and your CBC, so your complete blood count for your CBC, and differential, so your differentials being your eosinophils and basophils and things like that. Then also know your reference ranges for the things that comprise your ABG, your arterial blood gas. So very quickly, this book is divided into, just the forward, it's 10 chapters, and each chapter is it's 10 to 15 very short pages. And let me see if I can go, where is the contents? So 10 chapters here. I don't know if you can see that. It's kind of small. So the first chapter deals with disorders of potassium balance. So I deal with this a whole lot with my patients because my patients, I work at an LTAC, which is long-term acute care. So that's after patients have been stabilized in a previous facility for whether it's a gunshot wound or a car accident or heart attack or stroke or COVID-19. The patients come to our facility for further medical management and therapeutic rehab, which includes respiratory therapy as well. So we're constantly adjusting for patients' electrolytes. So one of the major electrolytes is potassium. So you've got to know the reference range for these electrolytes. So here I did like a fishbone chart. You'll see this very often. I think it makes for a very efficacious way to get to know your electrolytes. So, and this is the importance of understanding chemistry. So chemistry from undergraduate and even high school. You need to know your nomenclature and of course your signs. So sodium +1, potassium +1, chloride -1 with your, I don't know if that bicarb is right, but potassium 3.5 to 5.1 milliequivalents per liter. So I'm constantly correcting people's potassium levels. You should know the reference range. It's called hypokalemia if it's too low, hyperkalemia, Kalemia, if it's too high. And you should get to know the treatments for both of those conditions. That's in this book. Then there's hypernatremia if it's over 145, or hyponatremia if it's under 135 milliequivalents per deciliter. But get to know this. I'll do a longer videos about these. So this is the BMP, the basic metabolic panel, and this is the ABG. Continuing with the book review. We've got so it tells you how to control for water balance, for the potassium. Chapter 2, these are very short chapters. Chapter 2, oh wait, I'm sorry. Yep, my apologies. So chapter 1 actually dealt with sodium and water balance. Yeah, so I discussed sodium. You've got to know that a lot of the patients may be underhydrated, so that's going to affect their sodium levels. So you got to know if you need to do what types of IVs you need to do, especially your patients who are on dialysis. Then chapter 2 deals with disorders of potassium balance. Chapter 3, assessment of renal function and urinary protein excretion. We have a lot of patients who have Foley catheters. That's an indwelling catheter or a Texas or condom catheter. Some have suprapubic catheters where there's a catheter or a hose going directly into the bladder. It's being collected in a bag, and we've got to know their intake and output. So how much fluid are they getting with a water flush via a G-tube or a gastric tube or IV or by mouth, and then how much water are they excreting. If they have kidney failure and they may be on dialysis, that's where our renal doctor, our nephrologist, takes over, and really we appreciate the consults and the recommendations of our nephrologist. But for your purposes, you need to know these levels. You need to understand what's going on pathophysiologically for the patients that have imbalances in those. Chapter 4, what is it? That deals with metabolic acid-base disorders. This gave me a really hard time to understand. If a patient is in respiratory failure, we have a lot of patients who are on mechanical ventilation. You've heard that with increasing frequency with this COVID-19 pandemic. So patients may have respiratory acidosis, but they may be compensating from a metabolic standpoint, and that's dealing with the kidneys. So you have to have a good working understanding of that. There are I like algorithms that makes things easy for me to understand, because you're not going to remember all of this, so you have to keep reviewing it. It's going to show you how to treat those things. Chapter 5, arterial blood gas analysis, as I mentioned here. So your ABG on the bottom, your pH. If the person's got to know your levels, pH between 7.3 and 7.4. I've had people with pHs of 6, so they're in respiratory acidosis. You have to treat that accordingly. Then your PCaO2, that's the byproduct of our respiration, PaO2, and then bicarb and oxygen saturation. So I'm rushing through this. You're not going to have memorized these things very well in the beginning, because it takes quite a while, because you've got to understand the practical application of them. Here's another chart for you, another algorithm. I'm trying to keep this video under 10 minutes. And chapter 6, calcium, phosphate, and magnesium metabolism. So I've got patients who have cancer, so their calcium serum may be high. Some of them have had thyroidectomies, so their thyroid stimulating hormone may be low, so they're receiving exogenous thyroid medicine like Synthroid. 6 and 7, liver function test. I've got a lot of patients with hepatic encephalopathy, whether that's from hepatic cancer or years of alcohol abuse, so their livers they're in liver failure. Gives you some anatomy of the liver and some of the drugs and liver disease Again, another algorithm. Algorithms make it easy to kind of understand things. And chapter 8, lipid disorders. Probably all my patients are on statins. That's what we use to treat lipid disorders, so hyperlipidemia. You hear this good cholesterol and bad cholesterol, low-density lipoproteins versus high-density lipoproteins, hypertriglyceridemia. There's different types thereof. We may treat it with niacin, a statin, or gemfibrozil. Again, it's got these nice diagrams here, to, so you can understand the physiology of that. And chapter 9 is markers for cardiac muscle and injury disease. You need to understand this, especially if you're going to be doing emergency medicine. Somebody comes in with acute chest pain. There's something called the Levine sign, where they're describing crushing chest pain, and they're holding their chest. You're going to want to do an EKG and order cardiac markers. So your CKNB enzymes. You've got to understand the difference between sensitivity versus specificity for some of these things, your troponin levels. And chapter 10, immunological investigations. So I deal with people who've got things like Wegener's granulomatosis, Churg-Strauss syndrome, Addison's disease. These are where you order things like your IgGs, IgM. Again, another algorithm. So, sorry I had to rush through that. But, you need to understand the difference between IgG and IgM and IgA. So, that's it for this book. To me, it's a very easy read. Again, each chapter, you see it's not tiny writing. It's about 10 font. You can get through this book in about a week or two if you discipline yourself. A chapter every 2 days. You're not going to be an expert at this, but you can at least have a working understanding of clinical chemistry. That will help you. If I had to do PA school again, thank God I don't, I would have memorized the reference levels, and I would have read this book before PA school, because clinical chemistry kicked my gluteus maximus. But this will help you, I believe, in nursing school, PA school, and medical school. All right, that's it for now. I wish you guys all the best of success in your positive endeavors. Take care.